Articulators. Articulators are defined as mechanical device which represents the temporomandibular joint and jaw members to which maxillary and mandibular cars can be attached to simulate jaw movement. What are the purpose of articulator? First thing, it is used to hold the maxillary and mandibular cast in determined fixed relationship. Mounting of dental cast for the diagnostic, treatment, planning and patient presentation. It also simulates the jaw movement like opening, closing movements. The next purpose is fabrication of occlusal surface for dental restoration. Then we also can arrange the artificial teeth for complete and removable partial denture. What are the various uses of articulator? First thing, to diagnose the state of occlusion in both natural and artificial dentition. To plan dental procedures based on the relationship between opposing natural and artificial teeth. To aid in fabrication of restoration and prosthodontic replacement. It also helps to correct and modify the complete restorations and also to arrange artificial teeth. The basic requirements, there are two important requirements, minimal and additional requirements. There are necessary for the fabrication of complete denture to the patient's centricillation. So the basic minimal requirements are, it must be accurately maintain the correct horizontal as well as the vertical relationship of the patient's cast. The cast should be easily removable and also it should be easily attachable to the articulator without losing the correct horizontal and vertical relationship. And also the articulator should have the incisal guide pin that should have a positive star and that should be adjustable and calibrated. The other minimal requirements are, the articulator should have the ability to accept the phaseward transfer by using the anterior reference point. The construction should be accurate, rigid and of non-corrosive material. The moving part should move freely without any friction. The non-moving part should be rigid in construction. The design should be such that there is adequate distance between the upper and the lower members. The articulator should be stable on the laboratory bench and it should not be too bulky and heavy. The additional requirements are, the condylar guide should allow right lateral, left lateral and protrusive movement. The condylar guide should be adjustable horizontally. The articulator should have provision for adjustment of the Bennett moment. The incisal guide table should be mechanical table and that can be adjusted in the sagittal and frontal planes, or the table can be customized with auto-polymerizing resin or by grinding. The various advantages of articulators are, the properly mounted cast which allow the operator to obtain a good visualization of the patient's occlusion as well as the in the lingual occlusion or the lingual surface, which is easy to visualize. The patient cooperation is not mandatory when you are using the articulator. So once appropriate interocclusal records are obtained from the patient. It also will minimize the chat time and also the appointment time for the patient is reduced. The refinement of complete denture occlusion in the mouth is extremely difficult because of shifting denture bases and the resiliency of the supporting tissue. The interocclusal records that can be obtained and complete denture occlusion can be refined outside the mouth on the articulator. And more procedures can be delegated to auxiliary personnel when utilizing an articulator for development of patient's occlusion. The patient's saliva, tongue, cheeks are not factors when using the articulator. Limitations of using this: metal, plastic articulators may show errors in tooling. It not exactly simulate the intra-border and functional movements of the mandible. Errors in jaw procedure are reproduced as errors in the denture occlusion. So articulators do not have any provision to indicate or correct these errors. Thank you.